As healthcare professionals, we take great pride in our work. Every one of us has an important job to do, and we work hard to do it well and safely. Or do we? Workplace safety is an important part of every job, and yet it's an element that's often ignored. It's possible to get so involved in our responsibilities and daily routine that we don't see the safety hazards that exist all around us. Every job comes with a specific and unique set of safety challenges. Being aware of the dangers in our own work situation is critical. This is called situational awareness. Even an obvious safety hazard can be easily overlooked if we're too focused on doing our job. But when it comes to working safely, it's critical to see the big picture. This training program is designed to help us do just that, to see the big picture, to continue to do our jobs well, but to recognize and address potential hazards before they cause accidents.
What's your emergency?
I fell in the park. I can't get up.
All right, so let's go ahead and examine your knee. Uncover your leg here. All right, so I'm going to check your pulse. Can you press down with your foot? How's that feel?
It hurts.
Okay, all right. Now I'm just going to feel around here. Any of that hurt?
Absolutely.
All right. Underneath?
Yes.
All right. Can you move your leg? Can you lift your leg at all?
Mm-mm.
No? Okay. All right. What I want to do is get an x-ray of that knee, so we're going to send you over to x-ray. We're also going to give you some medicine. Are you allergic to any medicines? No. All right. I'd like to give you some morphine. We're going to give you 5 milligrams of morphine IV if you'll get that for him, and then we'll get an x-ray. After the x-ray, we'll come back, and I'll let you know the results.
Hello, good morning. My name is Michael. I'm going to take you down for some x-rays on your knee. Hold tight, it's going to be a bumpy ride.
Okay.
Alright, Mr. Johnson, it's just me and you today, so maybe stand, turn, and sit right here.
You want me to stand up?
Yeah, don't worry, I got you.
What are y'all, a little short-staffed today?
It's just me.
Right.
Easy. Just like that. Don't worry, our nurse will take care of that.
It's like a freaking zoo in here.
Well, you did hurt my shoulder.
Oh, who's the patient?
The tech returns the patient from x-ray back to the ER. It's clear from the way he's pushing the stretcher that he has sustained a shoulder injury from improperly moving the patient.
All right, sir. Have a good day.
Thanks.
All right, so we got the results back from your x-ray. Nothing is broken, but it looks like you tore your ACL. That's going to require surgery.
Surgery.
So I have you scheduled for surgery tomorrow at 8 a.m. Since the morphine seems to be working, we're going to give you some more morphine. I've admitted you up to the orthopedic floor, and we're going to get a few more films just before you have your surgery. Do you have any questions for me?
I probably do, but I can't think of them right now.
Okay, well, if you do, just have the nurses call me. I'll come talk to you, and then our nurse is going to give you some more morphine, and we'll get you upstairs.
Thank you.
All right. We'll see you in the morning.
Day 2. The patient is transported to surgery. Laparoscopic repair is indicated and the OR is dimmed for enhanced visualization of the monitors.
He's 120/78.
All right, the line's in.
Ow! Annie!
Annie, are you okay?
I hurt my arm. It really hurts.
Oh, Annie, looks like you've broken your wrist. Go find me a replacement and get this x-ray.
Okay.
Mr. Johnson, you got a pretty significant post-surgical hematoma. I'm gonna need to keep you an extra day, try to get the swelling under control.
Well, that's just great. You know, I tried to find the call light to get somebody to come in here. I couldn't even find it. And I hadn't even seen a nurse the whole time I've been here.
I will definitely check into that for you.
Well, y'all need to do something because y'all are killing me in here.
Hey, you ever been to Post?
Actually, I have. I was last week.
What was that like?
It's a little bit, it's a little nerve-wracking.
Why was Mr. Johnson left alone for over 2 hours? I'm sure if somebody had been checking on him, his fall could have been avoided.
I don't know anything about Mr. Johnson's fall. I don't see anything in his medical record related to it. That would have happened on the last shift. We weren't here. You want me to call her?
Yes, do that.
The patient is experiencing severe pain, bruising, and swelling at the operative site. Throughout the night, the pain worsens, and he begins to run a low-grade fever.
All right, Mr. Johnson, let's get your temperature. All right, looks like you've got a bit of a fever today. Let's check out your knee. It's a bit more swollen today, isn't it?
Yeah. You know I fell yesterday.
Oh, you did? Well, we'll have the doctor check on it. He'll be doing his rounds here soon, so I'm sure you'll be all right.
Okay.
All right, I'll see you later, okay?
Thanks.
All right.
There's definitely a significant hematoma that set in. I'm going to prescribe additional antibiotics, and I recommend we get you back into surgery so we can correct it.
Doc, you know I'm a fitness trainer. I mean, is this going to affect my ability to work?
Don't think you need to worry about that right now.
Why wasn't I notified about Mr. Johnson's fever?
He had a fever?
It's been noted in a chart at 12 hours ago.
Oh. It was only 102.
Give me some more antibiotics now.
I'm just glad to get out of here.
Yeah, we're glad to be getting you out of here. Thank you. Believe me. I'm glad to be getting you out of here too.
Are you okay? You need help?
Thank you. You know, I've really been working hard to push through the pain and get better. I help my clients do this all the time. No pain, no gain. But this is just not getting any better.
I understand that. And I know it's tough. But maybe you should give it a little bit longer before you head back to work.
Longer? I mean, how much longer? I mean, I'm not even able to make any money. I mean, this is an absolute disaster.
Mr. Johnson, your knee isn't showing the rebound we had hoped for. Maybe you should take another 6 weeks of low to no physical activity.
You do understand what I do for a living, right? I mean, physical activity is part of the job. I'm a personal trainer.
I understand that, Mr. Johnson. However, you want that tissue to mend properly. Maybe you should consider another job.
Another job? I mean, this is what I do. So what do you think?
Well, I think we've got a pretty good case here. It's clear there were several glaring violations on the part of the hospital. I recommend that we charge them with failure to ensure safety, failure to monitor, failure to notify, and loss of consortium.
Good.
The patient wasn't the only one who suffered injuries from this hospital stay. The radiology tech sustained several injuries, including a torn rotator cuff resulting in surgery, therapy, and medications. He also missed 6 months of work and is having trouble returning to routine duties. The circulating nurse sustained a compound fracture of the wrist, resulting in a loss of grip strength and range of motion. She also experienced a decrease in sensation. As a result of her injuries, she is no longer able to function as an RN in the clinical setting. Ignoring safety hazards can have a ripple effect, much like throwing a stone into a pond. It can not only adversely affect patients and visitors, but also staff and providers, and potentially consume enormous amounts of resources. During the course of every day, if each of us can take the time to simply look around us, recognize safety hazards, and address them, we can make the hospital a much safer place for patients, staff, and visitors. Being aware of the presence of danger in all the places it can hide can make it disappear. Like so many things in life, safety is a mindset and a choice. Let's work together to make our environment as safe as possible. It's up to all of us.